Hey, what's going on, guys? Dr. Kuang with Body Chiropractic, back again with another anatomy of pain video. In this series of videos, we'll be talking about the most common causes of pain and the anatomy thereof at different parts of the body. Today, we'll be talking and focusing more so on the knee. So let's begin by talking about a muscle that we already covered in the hip portion of this video series called the tensor fascia lata. Just to review, the tensor fascia lata comes from the anterior lateral portion of the hip and the pelvis, and then it extends the outside of the leg and attaches to the IT band or iliotibial band, and then terminates to the outside upper portion of the tibia right here. And again, just to go over, and that when that muscle gets tight, it pulls on the IT band, and then it creates a lot of pain and discomfort on the upper portion of the tibia. I don't know why that bone just disappeared, so let me put it back in there. Of the tibia. Okay, and again, this muscle can get tight from repeated internal rotation movements to the hip, or if your knee dives in when you're running or squatting, etc. When that muscle gets extremely tight, it'll pull on the attachment site of the tibia and cause that sharp shooting pain that most people feel. And again, we'll be doing some videos in the future about how you can release that muscle on your own and how you can stretch that muscle out as well. The second muscle, or I guess the second structure that causes a lot of pain in the knee, is one of the more obvious causes. It's the patellar tendon, and patellar tendon is located in the front of the knee. To explain the anatomy, the patellar tendon actually comes from the quadriceps tendon, and the quadriceps tendon is a tendon that attaches all four heads of the quadriceps muscle, which is the largest muscle located in the front of the thigh. So the four muscles that create the quadriceps is the rectus femoris, located in the front, right here, the vastus medialis located off to the side here, and the vastus lateralis located off to the outside here, and the vastus intermedialis, which is located in the middle underneath the rectus femoris. This muscle comes from the front of the hip. We already covered what causes the pain that's located in front of the hip that comes from about this muscle here. And then it envelops the patella, which is the kneecap, and it terminates to the tibia via that patellar tendon. Again, when one, two, three, or all four of these muscles of the quadricep gets tight, it can pull upwards on that patellar tendon, causing a lot of pain in the patellar tendon itself, or it can cause pain where the patellar tendon inserts onto the tibia. This condition is commonly known as jumper's knee, and the reason why it's called jumper's knee is because people who do a lot of jumping type sports, mainly basketball, if you're doing track and field or you're doing a lot of jumping sports, whether it be long jump, high jump, etc., has this issue as well. And the reason why jumping causes a lot of problems with this patellar tendon is because it makes it so that your knee has to travel very far forward, putting a lot of stretch and strain on that patellar tendon, leading to it being a little bit torn, etc., and that causes the sharp shooting pain that you feel in the front of the knee. Again, we'll be going over some stretches and some exercises actually that you can do to help with distributing the force associated with that forward knee movement or that jumping type movement across more muscles of the knee, so you don't have to overuse this quadriceps muscle, and you don't have to end up straining the patellar tendon. Okay, so that's the second most common, I think, reason for why people get knee pain. Moving on, we're going to now start talking about some of the ligaments that are located in the knee. And the ligament that I feel is most commonly torn is the anterior cruciate ligament. It's the ACL. Very popular in media because of how common it is injured. Okay, so let me focus a bit on that. The ACL is located right here. Sorry, that's a PCL. Where is the ACL? You know what? Let me just search for it. The anterior cruciate. Off to the right side. Oh, it's been taken away. That's why I couldn't find it. Okay, so the anterior cruciate ligament is a small ligament located in the inside between the femur and the tibia. And this ligament resists forward movement or forward translation of the lower leg bone, the tibia. Now, a lot of times this anterior cruciate ligament gets torn by having direct posterior to anterior force applied to the tibia. So if you think, for example, in the sport of football, let's say someone has their foot planted and it gets tackled from behind to the tibia, so the lower leg. And that tibia translates and has a very strong force going forwards. And that tends to tear the anterior cruciate ligament. So that's one of the more common ways that anyone can tear that ACL. However, the most common reason for why ACL tears occur is because people have repeated internal rotation and inward movement or inward buckling of the knee. So that inward buckling of the knee is known as valgus collapse of the knee. And that inward rotation of the knee is also associated with that valgus collapse of the knee. And this is a issue that's most commonly caused by a weak gluteus medius muscle, which is located off to the side of the hip here. I touched upon this on the hip video. The gluteus medius is the foremost stabilizer of the pelvis, and it creates external rotation or outward rotation of the hip, and it then stabilizes the entire hip, knee, and ankle complex and prevents that, like I said, inward rotation or inward buckling of the knee, that valgus collapse of the knee. So if you like your knees, and if you don't want to tear your ACL, and if you know that you have that tendency to let the knee either buckle in or rotate inwards, chances are, if you leave that unchecked, if you leave that unaddressed, your ACL will start to bother you. At best, at worst, your ACL will indefinitely tear. So if you want to prevent that from happening, working on your gluteus medius is a very good place to start. There are other things that you need to do. However, working on the gluteus medius is a great way to prevent that from happening. Okay, so we talked about a couple of structures. First, the TFL, the IT band, how that causes outside knee pain. We talked about the quadriceps muscle group and how that causes pain in front of the knee. And then we covered the ACL and how it's commonly torn that is. And then we also talked a little bit about the anatomy of the gluteus medius to stabilize the pelvis hip knee complex to prevent ACL tears. That is it for today's video. I hope you guys found this informative. If you guys have any questions, please feel free to leave them in the comment section below. And follow me for more videos like this. If you're on YouTube, please like, comment, share, subscribe, do all those things for more videos like this as well. All right. Hope you guys learned something today. I'll see you on the next one.